Hello, doctors and friends. We are from SGD B3 and now we are going to do a presentation about our student project, Intradermal Test Examination. And now let me start from Chapter 1, Introduction. I will go first. First, let me introduce myself. My name is Natalia with the 3 last digit student number 109. So the background of this student project is that intradermal test examination is a crucial diagnostic procedure, especially in identifying and confirming allergies and sensitivities in patients by administering small amounts of specific allergens or antigens just beneath the skin surface. The fundamental principles of interpreting this test revolve around two primary indicators, the wheal and the flare. This procedure is integral to the accurate diagnosis and subsequent management for allergic conditions. So the problem formulation is what is the definition of intradermal test examination, the principles, the indication, the tools and materials, the techniques, how to read the results, what are the interpretation, and what are the advantages and disadvantages of intradermal test examination. The objectives are written in the slide. The last on this chapter is the benefit of the student project, which includes student knowledge improvement regarding multi aspects of intradermal test examination, also aim to increase one understanding of the definition, principle, indication, tools and materials, techniques, and interpretation. This study is also anticipated to serve as a reference for future related research. That's all from me. Thank you.
Hello, my name is Siwa Caroline and my last digit number is 016 and I will explain about the intradermal test definition. So intradermal test is a skin procedure test that used to identify hypersensitivity reactions that triggered by immunoglobulin E in response to certain substances or allergens. And during this test, a tiny amount of a particular allergen is injected beneath the skin surface. After 20 minutes, the site is examined for common reactions like mild itching, swelling, and redness. Intradermal tests are effective in diagnosing different allergies such as insect stings, grass, pollen, fleas, drugs, and penicillin. And this intradermal tests offer higher sensitivity and more reliable results compared to skin prick tests. However, they are not suitable for food allergies due to a higher chance of false positive and potentially leading to a severe allergic reactions. That's all for me. Thank you.
Allow me to introduce myself. My name is Carla Noveline Manullang with my last three digits are 146 and now I'm going to present about the principle of intradermal test examination. So, as a specialized procedure, intradermal testing is often carried out in a hospital or other appropriate specialist facility. More particular uses for intradermal skin testing include the detection of venom allergy and IgE-mediated medication allergies, notably for penicillins. Similarly to a tuberculin test, every single allergen is injected intradermally to generate a wheal. Allergen concentrations range from 1 to 500 to 1 to 1000, which is significantly higher. It utilizes both a positive and negative control. A wheal of at least 5 mm or any reaction greater than the negative control indicates a positive result. When the skin prick test is negative, this test may yield a positive result, yet the findings may not be considered clinically significant. That's all from me. The next part will be continued by my colleague. Thank you.
Hello everyone, my name is Dewa Gede Agung Guptha with the last three digits of name is 072. So today I'll be explaining you about the indication of intradermal test examinations. So intradermal testing is mainly used to specify and confirm the result from the skin prick test on a skin allergies testing. Intradermal testing can also be defined as a method that is used for confirming a drug hypersensitivity, or we can say drug-specific immunoglobulin E antibodies. And it is frequently used for penicillin, general and local anesthetic agents, tetanus toxoid, iodinated radiocontrast media, insulin, heterologous sera, collagen, ciprofloxacin, and etc. That's all from me. Thank you.
My name is Nandhita Naaz with the last digit of student number 189, and now I will explain about the tools and materials for intradermal test examination. In principle, an intradermal test is carried out by inserting the material to be examined intradermally. The following are the tools and materials that need to be prepared to carry out an intradermal test. First is the drug to be tested, phenylethyl saline, 0.5% phenol in 0.9% natrium chloride solution or 0.9% natrium chloride solution. Positive control 0.01 microgram per milliliter histamine solution used to ensure an allergic state. Negative control 0.9% natrium chloride solution. 1 cc syringe for intradermal test. Medical emergency equipment such as bed, oxygen, infusion set, 0.9% natrium chloride liquid, 500 cc, 1 cc and 3 cc syringes, adrenaline, epinephrine injection, and cortisone or other parenteral corticosteroids.
Thank you for the opportunity. My name is Ningrum, and I will continue about the explanation. Initially, IDT is carried out using a 1 to 10 radio contrast media solution, or usually around 0.02 milliliter diluted in saline solution, with histamine and saline as positive and negative controls. Then IDT was developed using a pure radio contrast media solution and various tools and materials, one of which used 27 gauge needle. Several contrast agents that can be used in examination are iopromid, iohexol, iopamidol, and so on. And the strength that can be adjusted to suit the needs, with ratio 1 to 10 and estimate between 270 and 370 milligram per milliliter.
My name is Gede and Renathan with regional student number 193, and now I will explain about the technique of intradermal test examination. There are a few steps to do intradermal test examination. The first one is to make sure use the sterile technique and fill the syringe with the test solution. Change the needle if it is not a test and tap the syringe to make air bubble rise to the needle end and push the plunger to the 0.02 milliliter mark to expel the air bubbles and excess volume. A syringe with flat end plunger is better for measuring the volume of the test solution. With the bevel of the needle facing up, pierce the skin tangentially in the upper dermis at the 10-degree angle to the skin surface. Slowly inject the measured volume of the test solution into the skin. That's all from me. The next part will be explained by my colleagues. Thank you.
Thank you for the time. My name is Gede Saputra with last 3-digit number of name 018, and I would like to discuss with you guys about how to read the intradermal test examination. Reading the results of intradermal test examination involves observing the skin's reaction to the injected allergen by factoring 3 different variables. The first one is wheal. Wheal is a red itchy bump that appears at the injection site. The size of the wheal is a key indicator of the reaction. A positive reaction typically presents as a larger, more pronounced wheal, while a negative reaction may have little to no visible wheal. In addition to the wheal, we should also observe the surrounding area for a redness or a flare. A flare is an erythematous macula in which a larger flare may indicate a stronger reaction. And finally, other than observing morphological feature, we should also account the timing. The size of the wheal and flare is measured typically at specific time intervals such as 15 minutes or 30 minutes after the injection. Thank you.
Okay, hello, my name is Wilbert Purnamasidi with last digit of my student number is 135, and now I will explain about my presentation with with reading the result of this examination. So, for the result, there is 2 outcome. The first outcome is normal test outcome or negative test outcome, and the next is abnormal test outcome or positive test outcome. So, if the test is classified to normal, the skin will absence to reaction to allergens. So we will see absence of skin reaction to allergens, and it means no allergy to the test substances. But in other hand, if the test was classified to abnormal, skin will look presence of red, rash, wilt, urtica, and this indicates a reaction. These reactions, it's mean the patient is positive. The patient is linked to specific substances and the patient is allergic. And the stronger response is suggest height sensitivity to the substances that we test. Maybe that's all from me. I give it to my friend. Thank you.
Hello, my name is Kevin Andrian Candra with my SGD number 095. Today I will explain the interpretation, the result of the intradermal test examination. The result of the intradermal test are interpreted based on the size and characteristic of the well and flare response. Well is the raised area of skin that forms at the injection site, and flare is the area around the well that is reddish and more extensive. The test result is said to be positive if the lump is at least 3 mm larger than the negative control, and the presence of a flare is also a sign of a positive intradermal test result. Positive intradermal test results do not always indicate a person is allergic. Other factors such as history and other symptoms should be considered when making a diagnosis. That's all from me, thank you.
Hello, my name is Margaretha Jesslyn with my last number is 248, and now I will explain to you the interpretation, the result of intradermal test examination. So, interpreting the result of intradermal test examination is a critical aspect of diagnosing various medical conditions such as allergies. Interpretation of intradermal test result require a nuance of understanding of the size and characteristic of the wheal and flare response. A larger wheel size typically indicates a stronger allergic response, while the presence of a flare suggests a more immediate hypersensitivity. Additionally, research conducted in 2019 emphasized the importance of considering patient history and clinical symptoms when interpreting the test result, as this factor can aid in making accurate diagnosis. Thank you.
Hello, my name is Joseph Adrianus with the last three digits of my student ID number 104, and I'm going to explain about the advantages and disadvantages of intradermal test. So for the advantages, the first one is it's very sensitive and can be considered more sensitive than other skin tests, for example, skin prick test. Next is that it can detect allergies to substances that require very small amount to trigger the reaction. And then in terms of diagnosing allergy, it can be used as a confirmatory test when other tests, for example, skin prick test or blood test, show inconclusive results. And for the advantages, the last one is it can also test for specific allergens that are relevant to the patient's medical history. For the disadvantages, it has a higher risk of false positive, and compared to skin prick test, it is more painful. If it's done incorrectly, it can induce anaphylaxis. And for the last one is it is limited to some allergens. In essence, food allergen.
My name is Aisyah Taqiyyaa with 3 last digit number is 076. Conclusion. An intradermal test is a skin procedure test used to identify hypersensitivity reactions triggered by immunoglobulin E in response to certain substance or allergens. Intradermal test is mainly used to specify and confirm the results from the skin prick test on a skin allergy testing. The results of intradermal tests are interpreted based on size and characteristic of the wheal and flare response. The test result is said to be positive if the lump is at least 3 mm larger than the negative control. The presence of a flare is also signs of a positive intradermal test result. This shows that a person has direct hypersensitivity to the allergen. Reactions can occur quickly within seconds or minutes after exposure. Positive intradermal test results do not always indicate a person is allergic. Other factors such as history and other symptoms should be considered when making the diagnosis. So, intradermal testing is a procedure to identify hypersensitivity. That's all for us. Thank you.